Atrial fibrillation is a rapid heart rhythm that affects the atria, or the top chambers, so to speak, of the heart, where the top chambers beat almost so fast you can't even count it. And those electrical impulses then move from the top chambers of the heart, or the atria, down through the normal conduction system of the heart, or the normal wiring in the heart, to the bottom chambers. And they make the bottom chambers of the ventricles beat fast as well, although not nearly as fast as the top chambers of the atria are beating. So it can lead to some various symptoms from rapid uncontrolled heart rates. The symptoms of atrial fibrillation are quite protean. They vary quite a bit, and atrial fibrillation is an intrinsically chaotic arrhythmia, and it leads to a wide array of random symptoms. Fatigue, shortness of breath are the most common ones that I see. Sometimes people will get palpitations. Occasionally people will get chest pain. Sometimes people are totally unaware of their atrial fibrillation, and it's pretty much everything in between being completely asymptomatic to being completely debilitated. And there's no right or wrong way to feel when you're in atrial fibrillation. The three things that I worry about with atrial fibrillation are: 1, stroke risk; 2, heart failure risk; and 3, how people feel when they're in atrial fibrillation. If someone has no symptoms in atrial fibrillation, it can be kind of a blessing and a curse. Without having symptoms, they're kind of spared some of the debilitating feelings that are associated with atrial fibrillation, but at the same time, they may walk around in atrial fibrillation unaware of it and be exposing themselves to risk of heart failure or stroke. So if they're not aware of being in atrial fibrillation, the first thing I want to prioritize is getting them on, and I would recommend getting someone on an appropriate blood thinner based upon the risk factors that come with their various medical conditions. And then making sure their heart rates are under control, and sometimes we'll put a monitor on someone, an ambulatory ECG monitor, to make sure that their heart rates aren't getting too fast when they're in atrial fibrillation, because rapid uncontrolled heart rates for long periods of time can lead to heart failure. If someone does have symptoms with atrial fibrillation, it becomes a little bit more challenging in a way. We need to find the appropriate therapy for them. One therapy would be medical therapy, where we put someone on an antiarrhythmic drug meant to keep someone in normal rhythm. Another option for folks is having an ablation for atrial fibrillation, where we put catheters in through the leg veins and either freeze or burn the tissue in the heart that's responsible for atrial fibrillation. And sometimes we'll lean on our surgical colleagues, and there are some surgical options for atrial fibrillation as well, whereby we can treat the atrial fibrillation without needing long-term medical therapy.